is my pleasure to introduce Ms. Stephanie Reinhardt, a candidate for the degree of Master of Public Health, who will now give the student address for the Public Health program.
Class of 2007, faculty, staff, family, and friends. Today is an important day for us graduates. Yes, today represents the day where we'll embark on careers where we plan to change the world and all that good stuff. But, more importantly, today represents the last day we will ever have to explain to anyone else what exactly we're studying in grad school. Yes, the age-old question, what is public health? And you guys, I'd be willing to bet that most of you have found yourself in a conversation that went something like this. You're at a holiday party, on the tee, on a date, if your grad school social life was better than mine, or pretty much anywhere you might find yourself in public, and someone says, "Oh, you're in grad school. What are you studying?" And you pause, and you look at them with a slightly awkward grin, because you know exactly what's about to happen. And you reply, "Public health?" And I'd be willing to wager $100, and please don't hold me to that because student loan repayments start any minute now, that you get one of the 6 standard responses. And many of you graduates, you've heard these before. And many of you in the audience have probably actually said these before. That's okay. So, in honor of this momentous day, I'd like to share all 6 of them with you. Number 1. Great. I have this rash on my back. It's just been driving me insane. Can you look at it? This one, here. Number 2. Oh, public health. Nice. Honey, what's public health? Number 3. Great. Are you going to be inspecting restaurants in the area? Because I am pretty sure they undercook their meat at Billy's on 3rd. You should really do something about that. Number 4. Bird flu. It's a conspiracy, right? Number 5. Public health, as opposed to private health. And number 6, my personal favorite. Oh, don't worry. I'm sure you can reapply to med school next year. I love that one. The 6 standard responses. You guys know them, yes? These have been some of the biggest challenges to overcome in grad school. How to explain to everyone else what exactly we're doing here. Perhaps part of the problem is that public health is so broad, and it's really difficult to explain that public health is pretty much everything. Yes, I'm mildly biased, but it is. In the words of our program director, Dr. Tony Schlapp, public health is an applied form of social justice. We've learned that public health is understanding that the spread of disease is not simply biological, but it is largely social, political, and economic. It is knowing that some of the most powerful influences on health, such as education, food supply, environmental hazards, and work conditions, have little to do with the formal health sector. And it is recognizing that the benefits of modern medicine do little good if they're not affordable and accessible to those most in need. We are in public health because we refuse to accept the world as it is now. We cannot accept the fact that roughly 8,000 people die of AIDS-related causes every day in the developing world despite the fact that highly effective antiretrovirals have been in existence for over a decade. We cannot accept the fact that 47 million Americans are uninsured, despite the fact that we have per capita healthcare expenditures nearly double that of other industrialized nations. We cannot accept the fact that residents of poor communities and communities of color disproportionately suffer the effects of toxic contamination and hazardous dumping in their neighborhoods. We cannot accept the fact that the asthma rate for children living in Dorchester is more than double that the rest of the state. And we cannot accept the fact that sexual education is based on political ideology rather than scientific evidence. See, try explaining that on a first date. Fellow graduates, we leave here today with a responsibility to take action against these things that we do not accept. It is on us to stand up and say, healthcare is not a privilege of the rich. In the words of Dr. Paul Farmer, I can't show you how exactly healthcare is a basic human right, but what I can argue is that no one should have to die of disease that is treatable. Our class will leave here today and implement this version of public health in many different contexts. Whether working to build healthy communities and safe spaces, increasing access to affordable health care, fighting for healthy school lunches, or opening clinics in underserved areas, we will embark on careers that attempt to equalize opportunities to be healthy. Our experience at Tufts has given us the skills and knowledge necessary to start crafting a world where one's health status is no longer a reflection of his or her socioeconomic status, race, gender, sexual orientation, or neighborhood. A world where the child of a poor family has the same right to a healthy future as the child of a rich family. We are now truly in a position where we can affect change, and I urge you all to take your knowledge and new skills and make a difference. As Dr. Seuss says at the end of the Lorax, unless someone like you cares a whole awful lot, nothing's going to get better. It's not. My mom has this huge grin on her face right now because I just quoted Dr. Seuss in my commencement speech in graduate school. But in all seriousness, it's these lessons from children's books, the ones that our parents read to us over and over and over again, that many of us carry with us today. So in honor of my mom, the children's book queen, and all of the other parents that read to us so many times, I'm going to leave you all with one more Dr. Seuss quote. This one from Oh, the Places You'll Go. Congratulations, today is your day. You're off to great places, you're off and away. You have brains in your head, you have feet in your shoes. You can steer yourself any direction you choose. You're on your own, and you know what you know. And you are the guy who will decide where to go. I wish you all the best of luck and tons of happiness in the future. Class of 2007, thank you for a wonderful experience together.